Good morning, everyone. Welcome to the October 18th, 2021 meeting of the Whatcom County Incarceration Prevention and Reduction Task Force. Before we begin, we acknowledge that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, and Semiahmoo people who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us together here today. And please join us in uncovering such truths at any and all public events. I'll call the meeting to order with my co-chair, Jack Hovenier. We have a quorum in place. So the first item on the agenda we'll give to Jack.
Thanks, Stephen. Good morning, everyone. We're gonna dive right into some process business. Some of you may recall we had a that's my Mickey Mouse watch. Sorry. Some of you may recall we had a decision a few months back where we realized there was potentially some ambiguity in our rules of order. So the steering committee discussed that. We spent several months discussing it. Mayor Kortheis pointed out some of the ambiguities, and we believe we have clarified things. So in the future, if there is a decision that is somewhat close, and historically in this task force, this was after 5 years, the first time we'd found the decision where the issues of quorum and who's present and so forth became a factor, but it did become a factor then. We want to avoid that for the future. So the proposed amendments to the IPRTF rules of order specifically state, and Jill, please correct me if I get this wrong, so I'm doing it from memory, but I think I'm correct. We have to have 51% present to do business. Once we have 51% present, those members present constitute the quorum. And to make a decision, most decisions would require a majority or 51% of the quorum present. Some require 2/3, and those are spelled out in the appendix to the rules of order. So Jill, does that sort of match your understanding if I described it correctly?
Currently, the requirement to pass a motion is more than half of the total membership minus the vacant positions.
Oh, I should say more than half versus 51%, correct. So that's basically it. I'm happy to report the steering committee went back and forth. We spent a fair amount of time on this. Those of you that do process know that these type of things can take a lot of time and create a lot of energy, but we have a unanimous recommendation to approve these as is at the steering committee after going back and forth for a few months. And so what I am looking for is a motion to approve the proposed amendment to the IPRTF rules of procedure as indicated in your packet.
So moved.
And I believe Dan Hamill moved. Do we have a second?
I so move.
Thank you, Darlene. All right. Do we have any discussion or questions prior to making a decision? All right. Let's see. This is interesting, Jill, because we can't see everyone. Do we do an? I guess I can. I don't really want to do a roll call. Can I just? I guess for those people able to maybe turn on your camera, or you can use your hand if you know how to use your hand, and I'll make sure that we count any abstentions and negatives to ensure that we have a correct decision. Thank you, Tank. I see your hand. Okay. All right. All in favor of approving the proposed amendment to the rules of procedure, please signify by raising your hand. All right. Do we have anyone opposed? I'll let the hands go down. Moonwater, are you opposed or is your hand still up? It's okay. You're not opposed. Great. I don't see any opposition. If there is opposition, if you could put on your audio so we're aware of that for the record. All right, hearing none. Do we have any abstentions? Anybody who wants to be recorded as an abstention? Okay, I see no abstentions. The motion passes. Is that
Okay.
good, Jill? I just want to make sure if she needs a counter, the motion passes is sufficient.
I'm sorry, did you ask me a question?
Yeah, I think it was actually a unanimous, but do you need an actual counter? Is the motion passes sufficient for our purposes?
The motion, no, the motion is sufficient. Thank you.
Great. Okay, perfect. I just wanted to make sure we clarified that and we were done. And moving on, Stephen, I'm gonna lob it back to you to address the data collection and index.
Uh,
But I don't see Caleb.
no, I don't see Caleb.
Why don't we go out of order and maybe jump? Yeah. Okay.
Barry, are you able to come on camera or at least unmute and we can have you talk about resuming the
Yeah,
the Public Health, Safety and Justice Initiative.
sure. Thanks, Stephen and Jack. Yes, the council at our September 28th meeting, we took a look again at our stakeholder advisory committee process. And as well, we looked at the resolution that we passed back in 2019, which was the planning principles around criminal justice and how we were going to look at needs assessments and things like that. And the council voted to resume the stakeholder advisory committee process. And it's going to be kind of a slow rolling start. We have the first thing we have to do, which has already been done. We sent out letters to all the members to find out, since it's been so long, we wanted to find out how many folks were still interested in participating. And I don't have that count in front of me right now. It's just the deadline was last Friday. But after we figure out those vacancies, we will then take steps to fill those vacancies. That's the first thing. The second thing we did was we reaffirmed all those planning principles in that resolution, given some of the new factors that we've been dealing with in this committee. And that would be like the Blake decision, all the COVID stuff, and the law enforcement reform bills. We listed those as factors that will be, that are new things since the last, when we passed those planning principles. So we'll have to take these into consideration. So that's all we did. We just acknowledged that we wanted to restart that process and reaffirm those principles. And I think we will be discussing it next week. I don't think we're going to do appointments quite yet. But we'll be probably doing those appointments in early November. So that's basically the update.
If I could add, Barry, and tell me if I'm going too far with this, just as backdrop, because it was a while ago, the council had also contracted with a private sector planning organization. Is that correct? And the idea was to do a criminal legal needs assessment and maybe start shading into rethinking another proposal for a new jail building.
Well, I would stop short of saying about a proposal, but certainly the looking at the needs assessment is critical. The contract has expired that we had with HOK, and
Right.
in talking with Executive Sadu and Sheriff Elfo and Prosecutor Ritchie, we kind of wanted to take a little different approach that might be a little bit more of a home, locally generated needs assessment with some of the talent we have in our community. So we're still working out some of the details to that and how we're going to set that kind of planning and steering and policy side of things that would help aid the stakeholder advisory committee in their work. So that's the more to come piece. we'll be, tackling that as we go along. So hope that answered your question, Stephen.
Yeah, so should we make this an item for next month's agenda as well with an update to come?
Yeah, I think that'd be a good idea. If there's nothing more to report, we can always just pull it, but let's go ahead and maybe schedule it because I think there'll be some news by then.
Okay, great. Jack, back to you.
Heather has a question.
Oh, I'm sorry, Heather. Please go ahead.
Good morning, everybody. Barry, I'm sorry if I missed this. Can you remind us what role you are thinking this task force will play? And is it as the Law and Justice Council or as the task force? Can you tell me a little more about that? I just can't remember.
Well, that's kind of the piece that isn't decided yet. But one of the ideas was that there's a lot of talent here and a lot of experience here on this in our ranks, and somehow to be able to tap into that, I think, is very, very valuable on that kind of that local homegrown piece. So we'll be looking at how we might incorporate that. And again, that would be in like a steering and a policy role that would help guide the work of the strategic, or I keep wanting to call them the Strategic Air Command, but because it's SAC, but yeah, the Stakeholder Advisory Committee. So yes, Heather, that's what kind of the plan.
Okay, thank you very much, Barry. Jack, do you want to introduce Caleb in the next?
Yeah, absolutely. I saw he was here. So Caleb, if you're ready, or Eric, if you're ready to start, we wanted to kind of get an overview on the next steps for data collection and kind of an update on index if you're ready to proceed with that.
Yeah, sorry about being tardy. Hit the ground running here this morning.
Don't worry about it. We have people that you don't have to have an excuse. Our jobs are such that you're fine. Thank you.
So I apologize. I wasn't at the beginning of the meeting, so I'm not sure if we covered any of this material already, but we had a good discussion on Thursday last week, setting up some questions or potential questions that we can ask Dr. Harris if we can set up some time for her to sit down and help us get a direction to travel. We talked specifically about kind of what available information is out there currently. What we would like to see in the future is that list that we had. We have a data matrix, I think it's what it's called. We would like to see that updated to see what is available. And we think that there's some opportunities there to maybe answer some easier questions, or low-hanging fruit is too simple of a word, but there might be some questions that we can answer relatively quickly to give us some early wins and get us an opportunity to move in a good direction that way. And then we also talked about the potential or the possibility of entering into some more formal relationship with Dr. Harris, hopefully to see if we can, and this is all obviously very new, but to see if we can find out if she would help us to, narrow our focus and get a good direction of travel moving forward for data collection. I don't have a ton prepared because I've been off for the last couple of days with some medical issues, but I am willing to answer questions, or if anybody has anything that they want to mention, I am willing to help out with that.
I am not seeing any hands at this point.
All right.
Okay. I see Heather's.
Well, I was just going to ask if you're willing to share, what are your initial hopes around what data you'll be able to start collecting after this or sharing?
So I think what my initial hope would be is that we can get much more of an elevated view of the criminal justice system, such that when we're able to look at all of the data collection, it can be an informed decision-making perspective, so that we can say, hey, look, we know that if we do this over here, it affects this downstream or this downstream. And so this is a good thing or this is a bad thing. We can avoid that. So again, having a higher level collection of information gives us better perspective and hopefully will allow us and all of the decision makers in the criminal justice system to make more informed and better decisions. So that's the hope, that's and what that looks like to me has always been some form of data collection warehouse or database that exists separate from all of our individual siloed systems, and that we can pull data from or query information from that, and that can be made readily available to any of the decision makers in terms of what kind of questions people have. And the key here is we have to be very specific about the questions that we're asking, because you can get different answers depending on the kinds of questions you ask. And I have specific examples for that. One of the things that plagues me is how many people in jail right now today are sentenced and how many are pretrial. That is a very complicated question. There are so many people who are here on more than one offense or maybe multiple jurisdictions, and it's not a simple thing. It could be one number right now, and then in 10 minutes it could be a different number, and then 20 minutes it could be a different number, because things change, and as they develop and as they change and flow and move ongoing, there needs to be some recognition of that and some update of that information. So that's, again, what I envision as a high-level database, a warehouse that we can mine the information from and help us to move forward with good, solid decision points.
So Caleb, I have a question, and I'm wondering if you're able to pull information from our system.
Well, so pulling information from your system, I'm not sure, because the current system is different than what you're going to, and what we're going to, we don't have a relationship with in matter of fact terms yet. I would hope so, but I don't know that for sure yet. The information that we can gather right now is through the Administrative Office of the Courts and Spillman, which is the system that the Sheriff's Office uses. I know that there is some information available on Long Arm, but I don't have the ability to pull that information. And so again, if we look, like here's where I'm sitting at organizationally, if we look to a higher level of distribution and say, hey, let's gather the information at this point, and then that can be available a little bit higher level so that it gathers information from all kinds of sources throughout the criminal justice system, I think that's the better look at this point. I see lots of hands.
Yeah, we have lots of hands. I think we've got, and I apologize if I have the order wrong. I think I have Dan, Byron, and Arlene.
I think Arlene was in front of me.
Yeah, Arlene, would you like to go first? And I wasn't sure. I think you were up and down. I apologize. And you are muted, Arlene.
That is a good point.
Okay. My question is, has the index committee done research on other cities that have already completed this task in order to understand how to go after the information we need, and what are the most essential questions?
Up to this point, Arlene, no, the index committee has not done research into those potential possibilities. Now, that's largely because what we've been focused on so far is what do we know, and what we knew didn't get us very far in terms of again, that perspective that I'm looking for. So no, not to this point yet. Right. We're hopeful that that is something that we can do in the future, and I think that's an excellent direction to travel, but we haven't done that yet.
But all that requires is some phone calls and some looking up what cities have already gone down this road and talking to people in charge of their data systems. So it's not that difficult of a task.
Arlene, what those questions are and understanding the answers is a difficult task. And it's our hope in that group that's going to interview Dr. Harris, that her familiarity with those systems, not only in Washington State, and there are a number here locally, but also across the board through her national work, that she might be able to identify some of the systems and some of the jurisdictions that are ahead of us on this score.
Thanks, Arlene. Dan?
Yeah, Caleb, you've got a monumental task here. I see it as being a huge, this is a perennial issue that we've been talking about for years now in terms of aggregating the data. You've got Spillman, Longarm, Gelada, whatever Eric's using over in the prosecutor's office. You've got Lead, Grace. You're gonna have ART stuff coming out online here, hopefully soon. So what I would ask as a behavioral health co-chair is I would want to have numbers on behavioral health calls, what those numbers look like, race and ethnicity data on basically contact, so charges that are out there in the field. And then you've indicated who's in the jail and for what reason. I think that's important. We've asked that question over and over again. So I hope that you can drill into that information and help us, provide some like a better look at our criminal justice system. So I commend you for taking this on. It's a big task, and whatever we can do on the behavioral health side to help out, we will.
Yeah, I appreciate it. And I want to pick on the point that I was making earlier a little bit about, whether people are pretrial or not in jail. The reason why that's such a difficult thing is because we ask for point in time information that is something that is continually updating and changing. And so the validity of a data point versus the validity of an ongoing and upkept system where at this point or even on an average or a span of distance and time, the data looks a little bit differently potentially, and it might be a good thing to keep track of. So that's why I was harping on that.
Well, Caleb, since this is such a big project, I think maybe adding one more thing on top of it would be a good idea. I just wonder if this might be a great opportunity to think about the missing data that's been always there and difficult to get out, which is the victim data. Who are those who are being victimized by crime? What's their demographic information? I think we lose a lot of information about kind of what's going on. And then we also miss out on opportunities to support other services and resources to those who are victimized. So just want to keep that in mind. If there's a system out there that's doing that already, I know it would probably mean how you change a lot of things, but especially in terms of crimes against children, the data does not come out really clearly. It doesn't feel like through law enforcement, and it's just different all over the board. So I just want to bring that up. Thanks.
Thank you. Heather, then Mike.
Yeah, thank you. I just want to report, so we've had a small success with this, integrating the Spillman system into Gelada. And the data analyst, Jeremy Morden, has been able to call a little bit of that information since we've made that integration. And to Councilmember Hamill's question, we've been able to identify some of those mental health calls. And of course, in our case, we're concerned about the diversion of those calls over to EMS. So we've been able to find some of that information as compared to what's being shifted over to EMS and what EMS is actually responding to. It's not a real deep amount of information, but I couldn't tell you that Gelada would be the centralized platform for it, but it does have some high integration levels to it. But I think that generally, if we can speak in terms or think about creating a community information exchange, which combines all these elements that we're talking about, would be very handy. But it still doesn't solve that problem of what question you're asking in that data that you're trying to get out of that integration. So, but we've had some small success, and we're going to keep plowing ahead of it. Our next integration, actually, interestingly, is with a hospital. We've had a hard time getting the hospital to get into this with us, but we did meet last week, and I think we made a small movement to get the hospital integrated into Gelada as well for that information. So I just want to give you guys that report. We're working in small bits on this over here.
Thanks, Mike. Dan?
I think I may have referred to gelada as gelato, but I think that's just what I want right now. So I apologize for that. I do have a question on the Blake, the fix out of the legislature. If I don't know if this is the right way to track this, but the whole piece of needing 2 diversions before potential jail time. I don't know if you're familiar with that one. That's one of the legislative fixes. I'd like to understand that a little bit better. And I don't know where to track that. I don't know how to do it, but I just want to throw that out there, Caleb, if that's something that you could take a look at and maybe just give us some insight as we move forward. This is a reference to the law that requires 2 diversions or 2 attempts to diversion. And I just don't understand how that's going to work multi-jurisdictionally. Somebody, if it happens in Ferndale and then they get arrested again in Bellingham, I just don't understand it. And I will, I want people to be successful in their, interventions, but I don't know how that's going to work. So just throwing that out there for you.
Yeah, no, I appreciate that. I don't know how it's going to work. I think that's the easiest answer is I don't think anybody's sure exactly how that's going to work because interjurisdictionally there is necessarily lacking information. So somebody might be encountered today, have a diversion, encountered tomorrow, have a diversion, encountered the day after that. Well, how do we know that that's their 3rd diversion if there's no method for tracking that? And the method for tracking that didn't exist prior to the law or the case law in effect. So there may have been some fixes in the fix, but I'm not sure that there's a better way to track it. Potentially, Mr. Ritchie might have a better eyes on that, but I don't know the answer to it yet. But it is something that I think we're interested in looking at.
Heather?
Thank you. I just had 2 things. One, there is a resolution that Whatcom County Council approved in 2015. It's 2015-021. Executive Laus at the time introduced this, and it was part of a Stepping Up initiative. And it requests data around the prevalence of mental illness in our jail and sets some pretty lofty goals about reducing that and creating more treatment capacity in the community. And I think that work got dispersed into different pockets, and we created the Crisis Stabilization Center, and the task force has taken on some of this work. But I would love for us to revisit that resolution and get answers to those questions that were really directly stated. And I think I just want to mention this too, because I think it lays a nice foundation as well, and dovetails with the work that Councilman Barry Buchanan's introducing with the Stakeholders Advisory Committee. And what's really exciting to me about the data, Caleb, is once we start to see the bigger picture, then my hope is that we can all start working toward the common goal of reducing incarceration safely. And we can create the really successful strategies because we'll actually have the data to know what to do, like you said, and if we're making progress, if what we're doing is working. And the third thing I want to mention is that Healthy Whatcom is the community's community health improvement planning process. They are using a tool called results-based accountability. And it's a really awesome way to bring complex community organizations and members together to work toward a common goal. And it provides a process for deciding what are the strategies we're all going to commit to. It provides that accountability to say, okay, what is a foundation's role in this work? What is our police force's role in this work? How can we all make sure we're not working against each other and that we're supporting this common vision? So at some point, if it's of interest, it could be a nice thing for this task force or a committee of the task force to explore, especially when you pair the complexities of our behavioral health system with our criminal legal system and the ways that we do need to work together to make this successful. So I wanted to just share those 3 things with you this morning. And I'm really excited. Thank you, Caleb.
All right, are there any other questions? I think all I want to say, and Stephen, feel free to weigh in. At steering committee, one of the reasons we wanted this discussion is, as I think becomes obvious, the more we talk about it, the more the complexities are, and the challenge of integrating these systems and getting information the task force needs becomes obvious. And while we don't envy you, Caleb, with your challenge, we wanted to create a space here for you to hear what people had to say, but also to let everyone on the task force be aware while we're working on it. There are some challenges, and in response to what other communities are doing, we reached out to Vera and others, and I'll just, the simple version of this is, this challenge seems to be experienced by every municipality and organization and group that struggles to get data across different systems in a criminal justice reality. We're not unique in trying to figure this out, and I suspect the solutions will be a mix of good analysis and some creative thinking, and we appreciate your efforts.
And I'll just add a comment from our discussions so far, a little bit higher level framework of what we're talking about. Probably sees this in three dimensions. One is we want this data to be able to inform the recommendations that we make and the decisions that the council and different criminal legal entities make. So formative information that directs us in the right decision-making process. Secondly, once we've made those decisions, there's an evaluative component so that we later can go back and see that the decisions we made are actually effective and achieving what we intended them to do. And then lastly, the same data is part of our transparency and our communications to the community so that they can see that what we're doing is well-grounded at the outset and productive in the outcomes, and they can have more confidence in the work as we move forward. So all of those dimensions weave together in what we're trying to work on in the data realm.
And with that, Stephen, I think I'm turning this over to you for ARPA funding. I think we are, if this topic is complete, and I think it is on index. Caleb, do you want to add anything?
I don't have anything specific unless, again, like I said, anybody has any questions, I'm willing to try and answer them. But I appreciate your guys' time.
Thank you.
Okay, so we're back to, let me just get to it. We're back to the letter that Heather and others drafted that we approved and that we sent to Executive Sidhu and the county council members with some general areas that we recommended allocation of ARPA funding for. I think the intent of this agenda item, and Jill and Jack help me if I'm straying already, is to try to get a little more specificity in what our thinking would be in these areas. And so I know there was a fair bit of discussion amongst a small group of us. Heather, if you don't mind, I might call on you to help flesh some of that out and help facilitate some of the discussion around some of those ideas.
I'm happy to help facilitate discussion. You know, I want to just mention though, the group that met was a subset of the Behavioral Health Committee. And then we also brought it to the Legal and Justice System Committee for review. And I'm not exactly prepared to share specific details or budgets per se, especially coming after, I don't know if any of you caught the Children's Task Force recommendations around ARPA dollars, how they can support children and family. It was such an exhaustive, amazing document that was so well researched about how you could leverage dollars. And this document was really set out to be more of that high level general values based and big categories of we know we need investments in these 4 areas, and we wanted to make sure that Executive Sadu and our Whatcom County administration knew that these were the areas that had that intersection with COVID impacts and also would work to help reduce incarceration safely and create more public safety in our community too. So if I suppose, Stephen, if the task force would like to, I mean, you all have expertise in all of these fields. And so if it is of value to go through each of these 4 things and you all share more about details, or if we can ask for a couple weeks to have another subcommittee meeting to actually drill down and bring back more specific details. And I guess I'd ask too, who's asking and why, and is there like energy and potential around investments in these areas?
So I think I'll call in help from Barry and Jack as well, because this item on the agenda comes out of the steering committee discussion. So I think the intent was to begin some brainstorming in each of the categories that the letter had spelled out. And I see Jill is about to inform us on what our discussion actually had been.
Sure. The discussion in steering committee was simply to have a conversation with Tyler Schroeder about what, if anything, the task force can do to forward its recommendations through the administration.
Thank you so much, Jill. And no wonder I see Tyler on the participants. Tyler, can you join us on camera or at least audio? Good morning.
Yeah, good morning, everybody. Tyler Schroeder. I saw Barry joined as well.
Yeah, Barry's on. So did you hear, Jill, what our hope is in getting a little guidance from you and how to proceed once we can fill in some details here?
Yeah, for sure. So the county council has been considering the American Rescue Act funding allocations and kind of priorities since the beginning of August. We've had good conversations kind of on a framework that was developed back then on a number of different priorities that American Rescue Act dollars can be utilized. I think at the upcoming council meeting on the 26th, there should be another discussion on those priorities. I've been able to look through the letter and want to compliment the task force on putting a really well-informed and good letter together about where some of the dollars should be allocated towards. I think that it would be helpful to get a little bit more information on a couple of the items, and we can talk about that. But you know, in general, a lot of the council discussion has been surrounding child and family priorities and childcare priorities. So you know, currently there's about 60% of the dollars from American Rescue allocated towards child and family, childcare, and housing, affordable, supportive, transitional housing. So I know that the number 4 on the letter that we got from the Incarceration Prevention and Reduction Task Force is supportive in transitional housing. And currently there, you know, as the council is making some consideration, there's about $13 million towards housing security. That would be for affordable housing projects, but also for kind of transitional and supportive services for those that are homeless as well. And there has been some discussion about setting up a family and child shelter, a capital project that there's been discussion between the city of Bellingham and Whatcom County. There are a lot of dollars that are been allocated to the criminal justice system, but a lot of that is more about working through the backlog, the court backlog associated with all of the cases that have not moved forward due to the COVID restrictions and just that court backlog that I'm sure members of the task force and the task force are familiar with. There is also some dollars that have been identified but haven't been discussed all that much for the alternative response team, alternative response, kind of the behavioral health calls and exactly how law enforcement and EMS and behavioral health support services can appropriately respond to those. So there's $800,000 kind of right now identified for that, but I think continued discussions need to happen on that. Where I don't see, and there has been discussion on workforce and some dollars for childcare workforce, which is I know a really big deal about retention and expansion of the workforce. But there really hasn't been a lot of discussion at the council level on behavioral health workforce, nor on the pretrial and reentry support. And I'm not aware of the 24/7 mental health urgent care facility, it kind of sounded like. So I think focusing a little bit more on those three issues from the task force to continue to talk with council members and kind of define them moving forward would be a good opportunity for the task force to work on. There is $44 million and that's spread out between now and 2024. So some priorities are kind of filtering to the top for allocation. But I just say that because there are some dollars that will be continued to be defined through 2022 for some program expansion or for some priorities that come up where, you know, pretrial and reentry support might be one of those, or the behavioral health workforce. So I think the conversation is timely, and I think we can continue to hear from the task force. And that all the money won't be allocated, but we are starting to talk about priorities. So following up on those three items, I think would be good. Barry, do you have anything else from the council's perspective?
No, that was an awesome update, Tyler. I think the only thing I would add is that really the council discussion's been around categories or buckets of where this, you know, where kind of percentages of this money will go. So most of what we've done is talked about, you know, what's the priorities, and the only thing we've really decided for sure you know, specifically would be the stuff he talked about with the court backlog, which we've already allocated. So there's more to come on that. We're continuing those discussions at essentially every meeting now, and we're kind of getting closer to zeroing in on what we think those priorities should be and what kind of funding should be associated with them.
One more piece of information, you know, those three items, behavioral health workforce and pretrial and reentry and mental health care, those are important topics, whether it's in American Rescue discussion or not. So I think continuing to hear from the task force on those, the council and the administration would be able to help form some ideas to move those forward, and could utilize American Rescue or could even look at other funding sources if it's determined that those are priorities.
So what I'm getting from this so far is that the conversations are ongoing. We may be a little later than some interests in getting into those, but there potentially is a good fit between where the conversations are now and the idea that Heather floated earlier of reconvening the group that drafted this and trying to come up with some more specific proposals that we can start to insert into those conversations, both with the executive's office and with the council. Heather, you were gonna add something there?
Yeah, I noticed Arlene is unmuted too. If you wanted to, I can cede my time to you if you.
Arlene?
Yes, I'm looking for my little window here. Okay.
You're muted again, Arlene.
Yes. As I listen to a variety of reports and discussions, most especially from law enforcement and emergency service, and I think about the alternate response team proposal, I constantly think about the fact that there is a giant missing piece to those rescue efforts, and that is an urgent care center, a mental health urgent care center. And what the complaints are from law enforcement, and this has been ongoing for many, many years, it's certainly nothing new, is that they have no place to take people in emotional crises. So we need very much a place for that. Crisis stabilization does not serve that purpose. It has a more specific set of standards for people. And one of the most important reasons, I think, for the significance of a 24/7 center is in the area of equity. We've emphasized that in our task force, the fact that so many things don't get to the whole population. So we see this system, an urgent care system, as being available to absolutely everyone. That would be across the board. And so the issue of insurance and so forth is a non-issue. Anyone can come and they can call or come in, or law enforcement emergency services can bring them there. And what will happen is they'll be triaged and met immediately. This is something that in general does not happen anywhere. This is a glaring gap in our system. So attendance to the problems is delayed by days, weeks, in which whatever traumas are going on get worse instead of better. So I see this as connected, totally connected to what law enforcement, emergency services, fire department, everything they're asking for this. They just don't ask for it in that specific term that we're using. Any questions about what I'm saying?
Thank you, Arlene. That was a good justification for that part of the proposal. Heather, do you want to follow up again now?
Yeah, I would love to convene a smaller group to provide more detail, and I'm really grateful to even be asked. That was another part of the letter, is we want to be in a position to support these recommendations and work with council and administration on those. And while we have the whole task force here, there wasn't a lot of detailed discussion. And if there is time, it'd be nice to, one, if you're interested and have capacity to help with those, kind of adding some details to those top 3 priorities, let me know so I can include you on the email. And Jill, also make sure we're not going to violate any quorum rules. Maybe you could let me know how many people would be our max, and we could also have a few different meetings. But I really am also curious about some of the people who weren't involved in crafting the letter, like just truth checking some of these needs. I'm looking especially at Maya, for that pretrial and reentry support. I'm curious if you agree with that kind of priority. I see Chief Tanksley's on the call with that 24/7 mental health center. Are you seeing that need too? If there's just general kind of advice, insight, comments on those top 3 priorities right now, I'd love to hear them, or you can call me later. I'll look to you, Stephen, as co-chair to kind of guide that. But as far as process goes, I'll offer that, that we could have some smaller group meetings too in the next week and a half to bring some more detailed recommendations back.
Maya?
I mean, we're in the process of hiring a second behavioral health specialist to help us in our work here, but a lot of that, you know, it's really around, I mean, to some extent, we end up doing a little bit of this sort of work on transition to the community, but you know, we're really trying to focus on mitigation. And so yes, without a specialist there to transition people from the jail, there's a huge lack there. There's a huge need there. They used to have one person or a part-time person, but now there's nothing. And yeah, I would be happy to meet in a small group to talk further about that, but we would strongly support that. The money is being spent on that.
One question I have for the task force is, would it be useful to have separate groups fleshing out each of these areas, or a single group trying to make some progress on the collective list of things? And Heather, if you have an opinion on that process-wise, I'd welcome that.
I think if they're separate, well, I think if you have expertise and capacity, pick your group. I think absolutely having really focused discussions about each one of those areas would probably be the most productive, and maybe having 2 or 3 people that serve as the collection of information and the editors of that. Everybody looks really excited about this work.
The letter did a really good job of describing the bottlenecks that we face over and over again in our efforts to craft improvements in the system. And so now's really the time to get down to saying what we'd like to do about that, it seems to me. And I know that the behavioral health workforce question threads through, I don't know, 90% of the conversations that I'm in within the task force. Perry, I'd be interested in your view on that because this is a statewide problem. It's a nationwide problem, really, and it involves so many potential partners in working toward solutions. I guess first, do you have some bandwidth to participate in those sorts of brainstorming sessions? And secondly, do you think how much progress, I guess, as I'm going to just say, how much progress do you think we can make on a local level to turn a corner on that?
Thanks, Stephen. Perry Mowry, Human Services Supervisor with the Health Department. You may or may not be aware that there is a state workforce that is tackling this and making some recommendations. Healthcare Authority, I believe. And if we haven't, I can give those to Jill so they could be distributed to folks. Just some of the ideas and developments that are coming out of that. The Behavioral Health Administrative Services Organization also has a group and input there on a more local level, obviously our region of 5 counties. And so they're, working separately, but also providing information to the Healthcare Authority and that particular group that is meeting on those levels. And from my perspective, at least initially, I think that this is definitely a state issue, has a number of things that are going on relative to Medicaid payments, funding. I mean, the kind of components that are sort of making up this, at least the behavioral health professional workforce challenges that are going on. And I'd like to, as much as possible, see what recommendations come out of those groups to begin to then answer that question more specifically on a local level of what we can do. And so I just continue to pay attention to that. And as you had mentioned as well, many of the meetings that I'm involved in, this topic definitely comes up with an array of basis and reasons being offered. I don't know how much research there is to it, but basis and for the cause of that. So hopefully I'm answering your question. I'm wrestling with my capacity at this point, just taking on some new roles and so forth. So I'm a little bit hesitant to involve myself in more until I fully understand what my responsibilities are, and covering for Ms. Deacon as she is retired. And so things are going well with that. I'm not excluding myself, but so hopefully that's a good enough answer for you at this point. I see that Dean White is also on the call and may be able to offer some thoughts as well.
Dean, welcome, and I see your hand up. Can you contribute anything here?
Well, I just want to say that I'm also willing to do some work on really two of those areas. One of them obviously is the workforce issue, and the other is the urgent care, mental health urgent care idea. They're obviously very much related, and I do have some thoughts about ideas around those. And since I'm supposed to be working now temporarily in the health department, helping Perry not have to be overwhelmed, I'm happy to back him up and do some work in those areas.
Welcome aboard. And I think I guess the flavor I get from what you said, Perry, is our progress here on this behavioral health workforce issue might tag along on some bigger scale efforts going on. So I think my first request of you is, would you please plug us in via Jill, as you suggested, to these other efforts going on so that we can keep track of them for use in our context. And then we can sort of see where that leaves us, and with perhaps some help from Dean, we can start to shape some ideas there. It also seemed, the second thing I take away from this, and I have to say the most encouraging thing new that I heard from Tyler was some recognition from the executive's office that the areas that we identified in our letter are not limited to the opportunity that ARPA funds provide us, that the executive's office, and I'm sure the council as well, recognizes these are long-term needs in the community, and can be addressed above and beyond the ARPA timeframe and the ARPA dollars themselves. So it may be that the workforce issues are going to be longer term efforts. Mike Hilly.
Yeah, thanks, Stephen. I'd love to be involved with this a bit as well. We're having multiple conversations over the EMS sector, both at state level, regional level, as related to diversion. And Dean, of course, and Perry sit on some of those related meetings associated with the crisis stabilization facility. And I deeply agree with Arlene. We need something like that that's 24/7, that has low barriers, triage capabilities, et cetera, et cetera. And I think the CSF is kind of there. I mean, the foundation is there. It just can be expanded and brought up to these levels that we're talking about. But I'd enjoy being a part of that as well.
So Heather, I think we have a subgroup starting to take shape there. Maya would be a great source on some of the pretrial and reentry possibilities. Other comments, other volunteers? Have we taken this as far as we can for today? Moonwater, please.
Hi, I just want, thank you, Stephen. I just wanted to pipe in and just ask a clarifying question around the the intent of this additional work that's being asked of folks and that folks are volunteering to participate in, is it specifically to further flesh out these broad brush recommendations in order for the task force to be prepared to better advocate when requests for proposals come out about how to use these buckets? So are we essentially asking people to support the task force to have a more specific list of recommendations in order to be able to endorse plans as groups and organizations want to apply for these funds when they become more available?
I believe the answer is yes. If anybody disagrees with that or wants to expand on the purpose, welcome to do so.
I think so I think a question that comes up for me, being an organization that may at some point in time have an interest in exploring the use of some of these funds to support some of the efforts that we're doing to affect and impact the system, would be whether or not is there an additional value set or level of specificity beyond specific programmatic areas that the task force would be able to use as a lens to endorse or not endorse letters of support, for example, that might come down the pike later. Just recognizing that not all of these funds have been made available and only a small number of them have actually been dedicated. There's likely in the coming years plus, going to be multiple opportunities for other organizations to say the work that we're doing supports these priority areas and may be interested in coming to the task force to ask for the task force endorsement. So just food for thought as people are diving into more specificity is, if we're coming up with a specific list of actual concrete projects and areas that could be funded, do we have sufficient information to inform future requests for support as these buckets become available? If that makes sense.
I think it does. And tell me, I'm going to say something in response and tell me if I've gotten your point. I don't see this conversation or the work that might come out of further conversations as being exclusive at all. And to the extent that there are opportunities to become clarified to further the values of the task force and that are embedded in that letter, I think those would be welcomed.
Wonderful. Thanks, Stephen.
Sure. Anything else on the subject of ARPA funds? Okay. Jack, can I toss it back to you?
Sure. Let's go to committee updates. And I think it might be useful, Stephen, to, in addition to steering in legal and justice, Perry, between you and I, we want to give a quick heads up to the task force on the direction of the crisis stabilization subcommittee. I think that'd be appropriate too, as I'm looking at the agenda. I'll let you take the first stab at that, Perry.
Sure. Now, I'm not sure, Jack, and I don't want to go off track here, just a general update of the Crisis Stabilization Center and activities.
If you want, I was thinking more, we had the discussion about that committee and its long-term presence in the task force and kind of what we've decided how often we're going to meet, and that you've very graciously agreed to be our, I hate to call you a temporary chair, but you agreed to stand in that seat for a while. But I think the whole task force would benefit from knowing how often we're meeting and what our direction is.
Indeed. So as Jack mentioned, discussion in that regard and sort of a back and forth of, boy, is there still a purpose for the subcommittee? Should we possibly fold that into other subcommittees that are obviously related to that? And if I recall correctly, the conclusion, at least at this point, was to keep the Crisis Stabilization Center subcommittee in place, but to meet with that subcommittee on a quarterly basis. One of the factors of that, at least from my perspective, is that there is a monthly Crisis Stabilization Center Advisory Committee working on a number of different components. taking a look at some of the data in terms of referrals and admissions and sort of working that data out. And then being able to bring that information. Mr. Hamill had made a request in terms of the behavioral health subcommittee that I am also a member of, as well as possibly the legal and justice. And so bringing some of that information regularly, but then meeting quarterly. Hopefully I covered it, Jack.
Yeah, I think so. I guess I just really wanted the task force to know we'd had a discussion about that particular committee, given that the Crisis Stabilization Center is up and running. And I think our decision was at least through 2022 that we remain a standing subcommittee, meeting likely on a quarterly basis, and then analyze, perhaps partway through 2022, what additional roles that committee might take, or if some of the functions it's currently doing would better fit into some other part of the task force. So I think that's the update. Okay. All right, Barry, steering committee.
Thanks, Jack. Gosh, we've covered so much stuff that's on this report, but I'll just highlight some of the things that we just talked about. ARPA was one of the things that we talked about at the last steering committee, and I think we got a lot of mileage out of our agenda item on that today. We talked about data available in Whatcom County and how it informs us as a task force, and that's kind of ongoing, and with the discussion about index and how that's coming along. We had a recommendation for legislative fixes for the police reform legislation. That's something that's going to be coming from the Law and Justice Committee back to the steering committee in November, and then potentially to the task force in November or December to talk about that. We had a discussion about restarting the stakeholder advisory committee, as we talked about today. We talked about the behavioral health workforce issue. That's something that's going to be talked about in these work groups that we just formed. Talked about the rules that we just changed today. We talked about the year-end report, which is due in December, and Jill will be bringing forward something to the steering committee at our November meeting for us to take a look at. We talked about the future of the crisis stabilization facility. That was just covered. Next steps for index, we just covered that. And there's a pretty big item. Unfortunately, I was unable to stay on the call not more than 10 or 11 minutes, but we had a discussion about how we might engage Dr. Harris in the future. And I think I'll throw that over to Jack and Stephen. They were there for the entire call, so with Caleb as well. So can you guys help fill in the blanks for that?
Go ahead, Stephen.
Yeah, we want to set up a chance to talk with Dr. Harris. We had a pre-meeting meeting, and Caleb, Mike Parker, myself, I'm drawing a blank. Who else was on that? Caleb, do you remember?
I'm trying to remember it as well. So I remember Barry being on the call. So
Yeah.
let's see. There was 5 people total. Did we already mention 5?
I think we've got 4. In any event, it was a very high quality small group. We were talking about some of the things that Caleb reported too. We were talking about the breadth of Dr. Harris's familiarity with other systems. We were talking about the sort of the persistent siloing of information and trying to get a handle on the an updated handle on the information we have and the information we want. And then the idea that we might broach with her of perhaps targeting what Mike Parker called some low-hanging fruit, which might be accountability or evaluative measures. For instance, how could we set up data gathering that would demonstrate effectiveness for the GRACE and the LEAD programs, for one example, and start with a more focused data effort. So we had some ideas for what we might broach with her. I think Mike is putting some notes together on that, and when we have those, I will reach back out to Dr. Harris and see if we can schedule that conversation, and that will then feed into probably the steering committee, both index and the steering committee for further review.
Thanks, Stephen. That's pretty much the end of our steering committee meeting. The one thing I wanted to ask Jill to do, if you could send the reports that are on the stakeholder advisory committee, the discussion we had on the 28th of September, and the criminal justice and public safety committee, there should be a memo and the resolution attached to that. If you could just send that out to all the task force members, I would appreciate that.
Okay.
That's all I have.
All right, any questions for Barry with steering committee? Okay, and next is Legal and Justice Systems Committee.
Am I muted? Can you hear me? Yes, okay. There were two primary topics for discussion at our last meeting. One was domestic violence offender treatment, and the other was a discussion of police reforms and some recommendations for that. On the first point, there was discussion about the lack of treatment providers and recruiting, training specialist officers with training on domestic violence and behavioral health. It was suggested that funding treatment by small city councils, getting them involved to play for services for people without any funds. It was suggested that we reach out to treatment providers to let them know that funding is available. Funding is requested for civil attorneys and legal aid for people who are involved in domestic violence situations and in child custody and divorce proceedings. So attorneys are needed. It's suggested that too that we improve access to effective treatment, including applying pressure to the healthcare authority, who is in charge of everything, and to Medicaid insurers as well. It's important to find evidence-based treatment and research on new standards for treatment, possibly using the Department of Justice federal grant funding for demonstration projects. It was suggested too that we engage an agency in Eastern Washington that can provide some remote services. The need for domestic violence treatment services from drug and alcohol treatment providers. Many times people are involved with dual diagnoses. The possibility of family functional therapy treatment when juveniles are involved with domestic violence cases. Bruce said that he will reach out to drug and alcohol providers with approval of the district court judges. And Perry said that he would ask the Behavioral Health Advisory Board about including funding for DV treatment in the contracts with the MCOs. In regard to the discussion on police reforms, this was Raylene King and Chadwick reporting on a recent meeting, and they have come up with certain recommendations. Law enforcement has to consider several tactics when considering the duty of reasonable care to try and work with folks to escalate situations. A lot of the discussion was pointing to gray areas where interpretation has gone on either by behavioral health sources or law enforcement. So some of the difficulties we're having now has to do with interpretation of the laws. And this doesn't seem surprising to me because I think when new laws come on board, there is a period of working out the details of what is meant and what's the intent. The intent of some of the laws was to reduce bias and racism in police work, but also to lower the use of force in handling criminal situations. They discussed also the meaning of the term imminent when they're trying to gauge threats, including how they pertain, for example, to juvenile runaways. A lot of misunderstanding is about defining the term reasonable suspicion. So the recommendations are, of course, to address these conflicting issues. And I think that the legislators are, back to the books and looking at the details of this. The committee members discussed the compilation of officer interaction and de-escalation with known offenders. Also legislative intent versus plain meaning of the legislation. Eric Ritchie will be meeting with a small work group to develop specific language and submit it to the steering committee for its November meeting. A third issue was discussed, task force communications. Possible topic message for the communications consultant to develop will include or might include law enforcement training, new jail diversion programs, the need for domestic violence offender treatment, and changes from the prosecutor's office and overall criminal justice system, such as LEAD. The other topics were postponed to next meeting. It was a very robust discussion and really valuable. Any questions?
I am not seeing any questions, Arlene. Okay. All right, I think the next item on the agenda is other business. I am not aware of any. Stephen, are you?
No, I'm not.
All right, and Barry or Jill, any other business, or are we at public comment? All right,
I think we're at public comment.
All right, okay. Well, I don't think anyone will object to being done a little early on a Monday morning, a fall Monday morning at that. Okay, we are at public comment. We've got 5 attendees. Jill, if you could please facilitate that for us, I would appreciate it.
Yes, thank you. If any of the attendees would like to speak to the task force members at this time, please virtually raise your hand by selecting the raise hand icon. No hands are raised.
Okay, then I think unless I'm missing something, I think we're done. Dean, welcome back. It's good to see you. Obviously, we go way back. It's nice to see your name and it's good to hear your voice. All right, I think with that, Stephen, you want to say anything else?
No, I think we've reached the end remarkably early. Thank you,
Very-
everyone.
Barry,
For your-
Barry,
Go ahead,
if
Joe.
you could stay after the meeting, that would be great, Barry.
So the meeting is adjourned. Thanks, everyone, for being here.